Everybody had lunch, everybody had Mike's lecture, very wonderful talk. Now you can take a nap. As we talked earlier, image should be diagnostic image. If the image is not diagnostic, what is the problem? Number one, your equipment. Your equipment, so more clear image you have, better diagnosis, better outcome, period. I get cases, people have picked up some second grade use human equipment and send me the images, videos, and there's nothing I can tell about it. I have veterinarians, they have top of the line equipments and send me the video. I can't tell what is going on. You want to make sure that you get diagnostic images, not just any image. Looking at the canine ear, what are we seeing there? That is a diagnostic image. Is it clear enough for everybody? It's a retracted tympanic membrane. In order to understand the diagnostic image, first of all, you have to know what is normal. Once you find out what is normal, you will be able to tell what is abnormal. You cannot jump onto the abnormal view and diagnose the problem. The feline one, that is also diagnostic image. What are we looking at here? If you remember what the tympanic membrane of the cat should look like, what do you see through that? All kind of mammalian anatomy. You are not seeing that. Why? We need to know why or what causes this kind of changes. So right now, what you're looking at is behind the tympanic membrane. What is the inner layer of the tympanic membrane? Does anybody remember? Mucus layer. There is a changes going on in the mucus layer. Okay, that is making the tympanic membrane opaque. What is there? What are you seeing behind the tympanic membrane? There are some little lumps going on. What is that? We need to know what is going on behind it. Let's go forward. We don't want to do this kind of ear medicine. That's what we have done for years and years now. I'm so happy to see this group that is taking 10 steps forward and progressing. We don't want to do this kind of medicine either. Who wants to do this medicine? We don't. So how can we be safe doing what we need to do? So what I did, I went to human medicine. Please, please, please get into human medicine as much as you can for years, right? You think that going to the Jordan knows that very well. Martin knows that very well. And so we went to Harvard Medical School's program, ENT program. You would think that veterinarian with humans, human doctors sitting there, you would be kind of, no, I mean, this is not my spot. It was surprising how they treated us, how welcome we were, and how much information we got from them. I started just like a veterinarian, anybody else does. Get out of school. What do you know about ears? Here is an anesthetized dog. Here is the cone. Here is the scope. You go find out what you see in there. That was the training I had. And I struggled and struggled and struggled and struggled. And went nowhere. Went to all kind of education I can get about the ears. I went nowhere. And then I started going to human side. And a lot of medicine is different in humans, but ear is not. Every single disease that we see exists in human medicine. All you need to do is modify that. The anatomy is a little different compared to human medicine. Location is different, size may be bigger or smaller, but everything is there. All the diseases that you see in humans are in veterinary medicine. If you see cholesteatoma or any other disease that I'm talking about, dig into human site, go do Google search, and you can apply exactly what you're seeing. So do not hesitate. I went to a lot of different human courses, and that is where I picked up what I'm doing today. These are all the people that I followed. I have more ENT surgeon friends than veterinary friends right now. And they are very helpful. I've been to a number of human conventions and given talks there. And they want to know, what are we doing? Can they learn and they can get some ideas from us? Or every time I have been to human convention or human courses, they will come and ask me, hey, you know, my dog has been having, right? It's invariable, it's just, and initially I used to sit in the corner, in the back, hiding from everybody, but then you have to introduce yourself and you say, I'm a veterinarian, and everybody turns around and looks at you. And what are you doing here? And then I tell them, we do the same thing what you are doing. I just want to see what you guys are doing. And they open up the door so well. So do not hesitate. If you have a chance, go take some courses. Okay? I worked on human cadavers, did exactly what they did, and then come back and apply in dogs and cats. These are all diagnostic images. This is my 1 month worth of cases. Okay? There is so much going on, and I'm a general practitioner, I'm not a specialist. I do what you most of are here doing here besides the specialist sitting in the group. But the most important thing is you want to look at the ears, every single ear that you can look in. You will develop your technique to look at the ears when the dog and cat is awake. We see 80% of the cats and dogs' ears when they're awake. Julia is excellent holding the dog and cat just. And over a period of time, what you want to develop is when you are going in the ear canal with the scope, do not touch any area. As soon as you touch the ear canal, that is very sensitive. Diseased ear is very painful. Just right now, I can, in my sleep, keep my eyes closed and I can go in the ear canal without touching anything, go to the eardrum. Develop your technique. Why is so important that we have quality equipment? Quality equipment is going to get you quality result. Look at this. You can see the red blood cells marching in there. That is a detail you want in your exam. Now they were talking about the little tiny perforation in false membrane. You can see that tiny if you have cleaned up the ear very well. This is a middle ear. This is the opening of eustachian tube, pharyngotympanic tube. This is mucus layer. Watch that mucus layer. See, the cilia is moving. All that mucus is moving. When you are facing middle ear disease, you want to make sure the ciliary action is replaced. When the middle ear is diseased, the mucus layer is completely shattered. If you do not put back the ciliary layer back, your discharge, your problem is going to sit in the middle ear. When there are diseases in the ear, we just go and take a sample and call it the infection, atopic dermatitis, allergies. You want to call those things after you have gone through this list of diseases. Once I go through this list, I have a very minimum reason to call it food allergies, environmental allergies. You have diagnosed the actual problem. You're treating the actual problem. When did I treat food allergy dog last time in my life? A couple of years at least that I don't remember diagnosing that. And even if it's a food allergy, it didn't respond anyway. But do your complete thorough investigation before you call anything. Where is the problem? Where is the disease here? What would you call? What do you think? How would you start treating this patient? Clean? Would you do culture? Not after listening to me, probably not. Say what?
I would have done previously to previous to today.
Previous, yeah. Okay. What is happening here? It's a discharge. The ear is very swollen, right? We cleaned it out. This is a very chondritis. The ear canal skin has been affected from dirty diaper. Dirty diaper has affected the cartilage underneath. Now it is all swollen. That is not a problem. It's a discharge that is making it happen. If we don't find out where the discharge is coming from, we are not going to be able to treat this here. You can do culture, you can do whatever you want, put the medication, antibiotics according to the culture. You are not going anywhere. The pus is coming out through the ear canal. Why is it? So, earlier we looked at the anatomy. Vertical ear canal is a cartilaginous ear canal. Horizontal ear canal, that's where the bone ear canal starts. Sebaceous gland, ceruminous glands are in the vertical ear canal. Once you get into horizontal ear canal, a lot of glands start disappearing. When you have an ear like this, you say, Tika, there is no room to go anything, there is no room to do anything. No. You can slide your scope through that little tiny hole, and you can go into the horizontal ear canal. Horizontal ear canal is wide open. Clean it out, visualize the eardrum. Find out where the problem is. This is the horizontal ear canal, opens up. Things are sitting right in there. What was the problem with this dog? Was the grooming. Long-haired dogs, they have a lot of grooming going on. Shampoo water trickling down in the ear canal is number one reason why I end up seeing ear cases. Number one reason. Number two, use of ear cleaning solutions. Number two. The first thing I tell owners, stop using ear cleaning solutions. Clean it out, that ear is absolutely fine. And they say, why didn't my veterinarian tell me? Why are they telling me to use ear cleaning solution? I said, you are keeping that soggy diaper dirty constantly. What happens? Take ear cleaning solution and put it in your hand and keep it there for a couple of hours. Your skin is going to start turning, it bleaches. It reacts to the detergent. If that sits in your hand longer, that skin is going to start peeling off, peeling off, peeling off. Same thing happens on the eardrum. The soggy diaper is sitting there. The squamous epithelium of the ear canal gets irritated. It gets thicker and thicker because it wants to protect the eardrum. That thickness over a period of time becomes a wonderful source of bacteria to survive. That skin is dead. No matter how much you clean that out, if you don't remove that skin, that is going to give you trouble after trouble. It is going to be non-responsive ear. Okay. Tumor. Clean it out, and you will, once you clean the ear, you will start seeing all this different pathology in there. Here is another case. It was all, when I got this case, it was all covered with discharge. All I had to do was just clean it out, see the problem right there.
Just quick.
Yes.
On those dogs that you think that it's related to the just incidents happening at grooming and stuff, do you recommend just people automatically have saline washes of their ears afterwards or something? How do you control for something that's out of the realm?
Good, very good question. There used to be ADL ear drying and flushing solution available, went out of market. I use that thing for grooming issue all the time, never had any problem. Now I learned today, Mike was talking about Dumburo and vestigial ducts added. I'm going to try that and see if that makes a difference. But ear drying solution is what you want. I have not been able to find any ear drying solution that I can swear by yet. Working on it. If anybody has any ideas, please, yes.
I use either burrows or quartermans after a swim, a bath, or a pluck. And that seems to dry it out. Quartermans is like
Quartermans.
a commercial version of burrows, but
Okay.
a little bit more irritating. And yeah.
Good. So here.
How do you get them so clean without saline when you're taking those photos? Like, are you washing them with saline to get those beautiful photos?
Yeah, I have few videos of how I clean out everything.
Yeah.
So we'll take a look
Okay.
at those. Yeah. Yes.
Yes, I can ask about dilute vinegar.
And somebody is suggesting dilute vinegar. I have not tried it. If it works, please let me know. Yes, sir.
What about something like Triz, EDTA plus Dex, no antibiotic in it, no antifungal in it?
Tree CDTA, I don't use it. I think it adds more moisture to the problem than anything else. I think the whatever they have put in has a good review, and that's what they depend on, that it's going to do a magic trick in there. And if the product is good, it's going to work by itself. If somebody has to do a lot of advertisement, commercial, that means they're pushing something that maybe not.
Even when they have mentioned that you are not able to solve their middle ear also, you can use Dex, EDTA and Baker there. Just a problem there that you can use.
Well, DAX EDTA, I mean, Baytril and DAX EDTA is fine if it works. I don't use it, so I don't know. Yes.
Propylene glycol containing ear cleaners like the Epiotic Advanced, they don't dry?
Glycol,
They do. The propylene glycol?
propylene glycol, yes. Right now, I use in my clinic, and if I have to send something home, I use pH Notrix. Okay, so I don't have any investment in that company. I am not a sales rep. I have no profit benefit from that. This is a product. This is the solution that I use. It's going to be right here, so yeah. What this does, it says ear cleaner, but I call it wax softener. It softens up wax, and that's all it does. And then I would put that in their ears, maybe a few days before, depending on how much the buildup is. I might see the dog next day, might see a dog in a week, and then clean the ear. You don't want to do this. This is a very typical look of shampoo reaction. And if you look at the ear canal over and over and over, you will know what is causing this kind of look. It's like if you have seen one maple tree, you have seen all. And this is very similar. It starts as a very small irritation, then it becomes more, We take a cytology, there is a yeast in there, we start treating with yeast. We do not pay attention. We don't educate clients to not let the shampoo go in there. You stop the shampoo going in there, problem will be resolved. Okay, thank you. All right, sorry about the video not playing, but this is basically the shampoo reaction. This is early stage of shampoo reaction, that it starts like this, and then gradually it will have more discharge. This is what ends up happening, that if it is not treated well, it will get more ulcerated ear canal. Yes?
How soon after the exposure to the shampoo do you start to see reaction?
That is going to depend on how concentrated the shampoo was. Diluted shampoo water going in there will take longer time. Now I can look at the ear and I say, well, did you wash your dog? Did you have a grooming a month ago, 3 weeks ago, a week ago? You will be able to pick it up. If you keep observing, keep noticing that, you will be able to tell how long and how concentrated the shampoo was. And then eventually it ends up like this. And we have so much trouble treating this kind of, because now it has turned into Pseudomonas, staph, all kind of resistant bacteria. What we were talking earlier this morning is once you treat the ear canal, how is it going to shape up? This ear canal has scarred up. It is not going to be a functional ear canal. It's not going to have proper self-cleaning mechanism. You will have to do something to clean the ear on a regular basis. And I use pH Notics. Depends on how bad the scarring is. Once a week, once a month, once in a lifetime, depends. This is a tumor. I had a video. This is Mike's handpiece that I'm using. I don't think the video is going to play, but it takes up. Mike has shown very well, plenty of examples how the laser works. But you can take this tumor with laser. First, I reduce it. This is a large tumor, so I reduce it, and then we use the laser. Follow this dog for several years. The tumor is not reoccur. Don't treat your kids at home. So discharging ear. You want to find out why the ear is discharging. Sue, what time do we take a break? In about 10 minutes? So, discharging ear. If ear stays like this for too long, you're going to have a lot of changes. This is after cleaning. And once the ear canal turns like this, I have a very hard time fixing it. It is practically impossible. This ear had the foxtail, the grass seed sitting in there for too long, and now it has become more permanent changes than temporary changes. Cholesteatoma. We talked about cholesteatoma. Later on, I'm going to have some video to go over what I do and how I treat them. But the cheesy production that you get, it is invariably cholesteatoma. This is external auditory canal cholesteatoma. Not necessarily cholesteatoma always is going to be behind the eardrum, in the middle ear. This is in the ear canal. And cholesteatoma is just, this is easy to treat. You can remove the cholesteatoma and laser it, get rid of the sac. You are pretty much done. Now, discharging ear. There's a tumor. Once you clean the ear canal out, Jangi was talking earlier, he had presentation. Clean the ear out, you will be able to diagnose the problem much easier. Here's a grass seed. It is anchored in there. This dog came, it's a pit bull, sweetest pit bull you can ever find. That was rescued dog. Rescue organization had him in the office. They could not stand the smell. All we had to do was just clean the ear out, find out what was there, remove that. Stricture. This is very much similar to false membrane, creation of false membrane, getting ready to create a false membrane. After treating the ear behind the false membrane, it did open up. So not always it's going to be a surgery, it's going to close up. We had to put, this hole is about 5 French opening. We had to put 5 French catheter, go in the middle ear, open it up, clean it out, and it responded very well. So not every time you have false membrane creating, it will turn into a nightmare. This is a, what is this? Diagnostic image. Fracture malleus. If the malleus is fractured, if you are doing tympanomeatal flap and you open up the tympanic membrane, invariably you are going to damage the malleus. Not a big deal. It shouldn't happen, but it's not the end of the world. The patient is still going to hear fine. This is the kind of image you want to look at. There is a middle ear disease going on. Most likely it's an inflammatory process. We have a surgery done on this one. We'll see the case later on. What? I'm sorry? Yeah, this is the tympanic membrane. It should be a little bit slanted, a little down, sunken. It is pushing out. So there's a fluid. If you look at enough normal eardrum, you'll be able to pick up what is abnormal.
There's this bulging towards you, right?
Towards you, yeah, out, bulging out. This is a diagnostic image. It says what it is. It's a pars flaccida perforation. This is when the ventilation pathway failed. You'll be surprised what we get out of this thing. The hole is about, I would say, less than 2 millimeter. Same. Pars flaccida cholesteatoma. Pars flaccida cholesteatoma normally affects the epitympanum, so you have to go in the epitympanum to remove all this. You see grass seeds all the time. You remove grass seeds all the time. You have to go back and see what you have removed and what you have not removed. There were so many fragments in there, little tiny tentacles left behind. And if you leave that behind, you're going to have problems. So normally I would wash the ear out with a saline in general. Pars flaccida this is pars tensa perforation. It's not pars, no, it's pars flaccida. Do you guys see that? It's right here. That is where we had removed the foxtail and it was penetrating through that. It's not a big perforation. It's very hard to even see on a magnified image, but it healed just fine.
If there's a perforation and you see a foreign body, would you still flush it? Like if you remove the grass one, would you still flush it if you're concerned about it?
I wouldn't hesitate, because if there's a perforation, you're going to push something in there, which the ear will get it out through the eustachian tube. The thing is, if there's a perforation, you do not want to use oil-based medication. You will cause hearing loss. I'm very careful about using the oil-based medication. This is healthy pars flaccida. Mike had the case of that. How do you know it's healthy? If you have seen enough, cases, then you know what is healthy and what is not healthy. This is not.
Sometimes it's nice when they're extended like that, because you can still, they're almost translucent,
Yeah,
whereas if they're brownish or amber or some colored fluid, you can see the fluid filling up, or you can rock the head while you're looking, if they're asleep. You'll see the fluid wave in there, you'll see it within the hard plastic. You'll see bubbles through the tensor.
yep. King Charles Spaniels are notorious for this kind of disease. King Charles Spaniel's ears. It produces mucus plug, clogs up the suction tube. It is so thick. I call it tissue plug. You pull it, tear it, it just feels like it's a muscle that you're dealing with. Myasthenic sclerosis. This is calcium built up on the eardrum. Happens because of the chronic infection, chronic middle ear disease. All right, so we saw this thing, tympanic membrane retraction. As far as why there is a retraction, the ventilation pathway has some blockage. There's a granulation. This is This is promontory. You could barely recognize this. Suction tube is right here. You could barely recognize this. This is all scarred up. There's a partition right here. So pars flaccida is up here. And that is all blocked up. And that causes the retraction of pars flaccida. So middle ear tumor, you can see through the eardrum. Just clean it out. Visualize what is underneath, and you will have the diagnosis. Retraction, and there is a polyp right in there. So you can diagnose polyp through the eardrum sometimes. Good old cholesteatoma, cheesy material. This is a dog that's made me start everything what I do right now. This dog belonged to a veterinarian's son. It was a working dog. The son didn't have hearing or hearing loss, so this was his working dog. And got into ear problem, went to the surgeon, and they said, we have to do the TICA, remove the ear. And he just flipped out. And he came and talked to me, and friend of mine, he's an ENT surgeon from the UK, he came, and he and I did the first ventricular minimally invasive surgery. And till the dog passed away not too long ago, lived for at least 4 to 5 years after this. Every time I saw the dog, I would ask them, did the dog have any hearing problem? The answer was no. There was no problem. Dog heard everything just fine. Hearing was just fine. That's what we want. We don't want to remove the organ. We want to remove the disease. That is the goal we should have. Otherwise, cutting and throwing in the garbage can is not a solution. And this is the foxtail going through, the grass seed going through the eardrum into the middle ear. Look at the middle ear. It is still so pristine. You would think that there's going to be so much infection, so much irritation, and all that. Middle ear is very resilient. Okay. All right, shall we take, okay, one last case. What do you think going on here? Glue ear. Myringotomy. Snot is coming out. It just kept coming out, kept coming out. All right, let's take 10 minutes break.